Get started now. Just a reminder, we have approximately 30 minutes, one question, one follow-up. We have Dr. Moore here today, so I'll turn it over to him for some brief remarks.
Good afternoon, everyone. Today, there are 129 new cases of COVID-19 in Ontario. There are 125 individuals in hospital, 127 in intensive care due to COVID-related critical illness, and I'm sorry to report that there have been 5 more deaths from COVID-19. A total of 13,644 tests were processed yesterday with a positivity rate of 1%. I want to thank everyone that's come forward to get tested. Overall, we are paying close attention to how the numbers are trending in Ontario and elsewhere, but these trends are in the right direction. We know that once Delta variant gets a foothold in a community, it can spread quickly, particularly amongst unvaccinated and partially vaccinated individuals. We all need to continue to remain vigilant. I want to commend the work of public health units across the province that have reached the goal of attaining 80% of the eligible populations in their jurisdictions with 1 dose of a COVID-19 vaccine. Particularly, I want to thank Thunder Bay, Ottawa, Halton, Leeds, Grenville, Lanark, amongst others, who are leading the province with their immunization rates edging even closer towards 90% of their population vaccinated with 1 dose. That is truly fantastic. Thank you for stepping up, for leading the way, and showing us that high vaccination rates can be achieved if we set our hearts and minds to it. And thank you to all our public health units and healthcare providers who are doing all they can to get shots into arms. We are in the last leg of the race, and we need every bit of your energy, enthusiasm, and professionalism to get across the finish line. We know how critical vaccines are to controlling this pandemic and saving lives. Due to the direct effects of the vaccination program, Public Health Ontario released today that it's an estimated 31,280 cases of COVID-19 amongst individuals 18 and over have been prevented to date. A further 2,496 hospitalizations or deaths have been prevented in individuals 70 years of age and older. Likely, these are also an underestimate. This is a fantastic program that's saving lives, preventing hospitalization, and protecting our communities. Despite this excellent work and excellent safety and effectiveness of these vaccines, approximately 2 in 10 eligible Ontarians have not received a single dose of a vaccine. We're very close to our provincial target of 80% of Ontarians aged 12 and over having been vaccinated with 1 dose, but we are at 66.7% with 2 doses. So there's around 1.8 million Ontarians still needing their 2nd dose. Our 7-day average for daily shots in arms is falling, and it's currently at 106,929. Just last week, our 7-day average was 145,638. And when we look at the vaccination rates in older age groups, roughly 1 in 5 between 40 to 59 have not received any protection against COVID-19 through immunization. This concerns me, given that we've seen an increase in hospital admissions for these age groups specifically during the 3rd wave, and they remain at risk if Delta rises in the fall. When we look at other age groups across Ontario, 35% of those 12 to 17, 30% of those 18 to 29, and 26% of those 30 to 39 have yet to be immunized with even a 1st dose. We must remember that the pandemic in many areas of the world now is in the unvaccinated populations, and these age groups and populations need better protection. The risk of getting COVID-19 is 6.4 times higher in unvaccinated individuals compared to those that are fully vaccinated, which means you remain vulnerable until you get your 2 shots. We have capacity in vaccine to see these immunization rates climb faster. We have a steady supply of the mRNA vaccines, including Moderna and Pfizer. And both of those have been proven to be highly safe and effective. It's also important to note that with a 28-day interval needed between doses and 14 days to follow up to build full immunity, today is the last day to get your COVID-19 shot in order to be fully immunized in time for a return to school on September 7th. It's 42 days away. While the last thing we as students want to think about on a summer vacation is a return to school, it is in fact vax to school time today. So it's a call to arms for all those students who haven't yet received their first doses to start thinking about it this week, please. Immunization clinics are accepting walk-in patients across the province. And I know a lot of parents and caregivers have been juggling work and childcare during an incredibly busy summer, but I encourage you to get your child vaccinated today. School starts 42 days from now. It's time to act so Ontario's youth can begin the school year as safely and normally as possible. So in conclusion, as we continue our excellent work to achieve the highest immunization rate possible, it's important to keep in mind the simple actions that will help minimize and increase number of cases anticipated in the fall. I encourage all Ontarians to continue to wear a mask in closed spaces or crowded places and amongst large group of people where you can't physically distance. Stay home when ill. If symptoms persist, get tested for COVID-19, even with mild symptoms, and wash your hands thoroughly and regularly. Please get your flu shot or get your COVID shot if you haven't already, and keep adhering to the basic public health measures and workplace safety measures to keep yourself and your community safe. And with that, I'll turn it over to any questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Randy Rath from CHCH-TV. Randy, please go ahead.
Hi, Doctor. Speaking of vax to school, does it make sense from a public health point of view to make vaccination mandatory for education workers in the province?
I will say that I think our schools have very good infection prevention and control policies in play. That even before vaccines, we were able to limit the spread of viruses in the school setting. So I'm very comfortable with the basic prevention strategies that are in place. Adding a significant proportion of students or workers that are immunized only further promotes the safety of the school setting. I don't think we need to have mandatory at present, given that at a population level, we're achieving 79.7% of Ontario's eligible population having their first doses. Yes, I'd like to see it higher, and we won't stop till we have higher rates across Ontario over the coming months. But we're doing so well, not requiring mandatory immunization at present, that I don't think it's a necessary tool in our toolkit just yet.
Follow-up?
Are students and teachers going to have to wear masks? Are you going to recommend that when they go back to school in the fall?
Still 42 days away from the start of school. That's many weeks in the face of Delta, and we'll monitor that situation closely. We will want a conservative, safe opening in the school setting, and that may include masking. The Ministry of Education will be releasing their plan, which we've had input into in the coming weeks. I look forward to reviewing that final document, we also may encourage a regional approach if there's very limited activity in certain regions to be permissive of not masking. But that plan has not been finalized at present. I would say if Delta starts showing its head in the coming weeks, that we would be very conservative and would recommend masking for the appropriate age groups.
Next question.
Your next question comes from Holly Mackenzie-Sutter. From the Canadian Press. Holly, please go ahead.
Hi, Dr. Moore. You mentioned earlier about the youth aged 12 to 17 that need to get vaccinated basically today or this week to be kind of fully protected for school. We've noticed that first dose rate for the age group has been static for quite a while now. So I'm just wondering if you can be specific about some of the factors behind why uptake is lower for teenagers and whether this rate that we're looking at right now is going to impact the school reopening plan, given that where it's at right now, quite a few kids likely will not be fully protected when school starts.
So good news is that 64.9% of those eligible from 12 to 17 have had their first doses, and 42% have had their second doses. So we're making good headway in that population. And we know during the summer they're often distracted. I do anticipate that anyone that's got their first dose will come forward after 28 days for their second dose. So I'm not that worried about the second dose population. We would love to see it higher. It does mean that we'll have a safer reopening, a safer return to varsity sports, to intramural activities, to music, to dance, to social activities in the school setting. And so I do absolutely encourage all students to consider getting immunized in the coming weeks. We still have plenty of time to start first doses and second doses in September if necessary. It will lead to the safest reopening. And the main means by which we keep our schools safe is by keeping a low rate of infection in the community. Any activity that I've seen in school settings reflects the community activity. So as a community, we also have a duty and obligation to all get vaccinated, to continue to wear masks, to continue to have good hand hygiene and get tested if we develop symptoms. I think that's the path forward for us in Ontario.
Follow up?
Great, yeah, and just another question about clearly and regularly reporting the numbers of cases among vaccinated and unvaccinated people and hospitalizations and deaths among those cases. We know public health publishes some of that data, but not very frequently, and it counts back to December, which didn't have that many people vaccinated at the time. So just wondering, if that would help your messaging about vaccines being effective to publish those numbers about hospitalizations and deaths on a more frequent and up-to-date basis.
Yeah, so we'll try to update you on a weekly basis. So on Tuesdays, I do get a report from Public Health Ontario that tells us the benefits of vaccination and the number of cases that have decreased as a direct result of immunization. And it's a little complicated getting the actual cases and tying it to their immunization status, but that is getting done by Public Health Ontario and reported to us as well. And I absolutely agree. I think that's essential information to be able to relay to Ontarians. The absolute benefit of the reduction in risk of getting COVID if you're immunized versus not immunized. And it is significant, a 4 times higher risk of getting hospitalized if you have not been immunized. And we'll continue to try to update that data on a regular basis. Thank you for that question.
Next question.
Your next question comes from Chris Rashowi from the Toronto Star. Chris, please go ahead.
Thank you. Thanks, Dr. Moore, for taking my questions. I was just wondering if you can tell us where you are right now with planning for back to school. Have you settled on any specifics around extracurriculars or anything like that?
Yeah, so it's always been our vision to have a full return to school in the fall, and I think that has been embraced by the Minister of Education. And from a public health vantage point, we've provided all the guidance on infection prevention and control that would allow students to have the safest and most normal return to the fall. So as and when the Minister releases that plan, I think you'll see that it's robust, it's safe, it has a significant amount of prevention embracing and integrated into it. And that it'll be, I think, a very positive return for the fall for all of our children.
Follow up?
Thank you. There also seems to be a bit of an issue for some parents whose children were born in 2009, but they're not yet 12, and they want their kids to be vaccinated, and they're saying that they can't get them vaccinated until they've actually had their birthday, which doesn't seem to be the case in all provinces. Can you just clarify what the rules are around that and if the province is looking at changing them?
Had legal advice when we had to interpret that regarding the randomized controlled trials. So it wasn't the age of 12 that the trials were done in. It was 12 and up. And part of the licensing for Health Canada was to ensure that you adhered to the randomized controlled trials and the licensing agreements for the vaccine. So it was our interpretation to follow the trials and the science to be 12 and up. I realize a couple of provinces haven't done that, but anyone turning 12 will be eligible, and we will have vaccine for them this year, but we had to adhere to Health Canada's recommendations to us.
Next question.
Your next question comes from Dave Woodard from the Globe and Mail. Dave, please go ahead.
Yes, thank you. Good afternoon. Dr. Moore, if we look at the numbers for 12 to 17 and think that maybe 2/3 of the students could be fully vaccinated by the start of school, why wouldn't you be okay with mandating masks, given that you said yourself that you wouldn't be okay with ditching masks for quite some time?
Yeah, no, I do see the benefit of masking in public spaces and crowded places and indoors. We haven't made a firm decision yet. That's still work with the Minister of Education. We have 7 weeks away that we're monitoring the data. And I do anticipate that we'll have a rise in cases by the beginning of September. I don't have a crystal ball, but we'll make that firm decision in the coming weeks about mandatory masking in those settings. I do, though, anticipate that we'll monitor the situation closely. If we do recommend masking, we'll monitor it. If the rise in Delta doesn't occur, we can change direction and have regional approaches with masking in schools if necessary. We'd also always partner with our local school boards, our local public health agencies to get their feedback and input.
Follow up.
Thank you. The federal government held a press conference earlier today celebrating that we're well ahead of schedule for the delivery of vaccines. But given the slowing of people in Ontario getting vaccinated, is there a concern that some of these vaccines will expire before they get to be used?
Yeah, that absolutely is a concern. And so we're being very cautious in terms of how many vaccines we actually order into Ontario. We would like to minimize any spoilage of vaccine or wastage. Obviously, this is a very precious resource globally. So we're monitoring our vaccination rate. We're monitoring our input of vaccines on a regular basis and don't want to take too much vaccine for Ontario if we can be using it elsewhere internationally or nationally. I am worried of the slowing in the vaccination rate. It's not unexpected given the summer and given that we've done so well with 79.7% of eligible Ontarians already receiving their first doses. We always knew the last 10 or 12% would be the most difficult, and I believe our local public health agencies, our primary care partners, our pharmacies are up for that challenge, but it'll be the most difficult. Often these individuals may be hesitant, they may have lots of questions, and I think that's the time for our primary care providers, our pharmacists, our nurses, nurse practitioners to have those conversations, answer those questions that individuals may have, make sure that the patients are confident and agreeing that they've had enough information to make an informed decision. And I do believe once they are provided with the information, they will agree to be immunized. These vaccines are safe. They are effective. They are reducing hospitalizations, deaths in Ontario as we speak. We're seeing a dramatic decrease in overall COVID-19 activity, and I think we can absolutely attribute it to the effectiveness of these vaccines to limit the spread of the virus. I call on all Ontarians, the left over 20%, to please have those difficult conversations, have your questions answered regarding the vaccines, and I do hope once you've had your questions answered that you'll make the decision to get vaccinated. It's the means by which we can get back to normal for the fall. We can minimize any surge in cases in the fall and any impact on our hardworking nurses, physicians, intensivists, paramedics that have been working full out for a year and a half. We owe it to our health system partners who have been working so hard to protect us over the last year and a half.
Next question.
Your next question comes from Colin DeMello from CTV News. Colin, please go ahead.
Hi, good afternoon, Dr. Moore. Just returning to the students who are unvaccinated, 12 to 17. So that's 300,000 students more than who haven't received their first dose of the vaccine. What kind of impact are you expecting that to have on the fall and the return to school plan? And will there be a separate set of rules for vaccinated students versus unvaccinated students in the school system?
Yeah, very good question. So we're working on the outbreak management for school settings in particular, and there will be a different approach to those that are vaccinated. If you are 2-dose vaccinated plus 14 days, we'll offer you a test if you've been a contact of a high-risk person, so someone that's had ongoing fever and cough or increasing shortness of breath. If you test negative, you can go right back to school, you can go right back to work. So terrific advantage of being 2-dose immunized by being able to stay in school and attend sports and participate fully in all the social activities of the school setting. If you are not immunized and you've been in contact with a high-risk contact, you'll be off for a minimum of 10 days. You'll have to get 2 tests, one initially and then another around day 7. If that test at day 7 is positive, you're off for another 10 days. And you can see that that is a potential for up to 20 days from school directly because you weren't immunized and because you were infectious to others and putting others at risk. So there is an advantage just alone, not to being present in school, full participation in all sports and activities by being immunized. And I hope parents and students see that advantage.
Follow-up?
I appreciate it. On another question about the vaccine approvals, I appreciate that this is probably a Health Canada jurisdiction, but what is your sense when it comes to approving the vaccine for children under the age of 12? Is there a timeline that you are aware of? What can they look forward to?
Yeah, thank you, Colin. So I'm in regular contact with the Public Health Agency of Canada and Dr. Teresa Tam and Dr. Howard New. Our fingers on that pulse. We know that the trials are finishing up, that they'll have the results to decision makers both in the United States and Canada in the early fall. And that's a potential licensure under the emergency use agreement for late fall, early winter. So we anticipate having to maintain the good infection prevention control practices along with anticipating the immunization strategy for that population if and when it becomes available. And I just want to assure families, parents that we're already anticipating the need to vaccinate that age group from 5 to 12 and working on a plan with local public health agencies, our pharmacists, and our primary care partners to ensure that that's available and accessible through multiple means like we have now.
Last question.
Your last question comes from Jack Howen from Queen's Park Briefing. Jack, please go ahead.
Hi, Doctor. For the last question, I wanted to turn your attention to something a little different, the overdose crisis, which has obviously spiked during the pandemic, but was increasing in severity for years before that, as you know. So what about Ontario's strategy do you think needs to change as we come out of the pandemic? What will you be recommending to government?
So I am actively working on the response to the opioid crisis, which continues, and it saddens me deeply of the ongoing death of younger people in all of our communities across Ontario. It's very near and dear to me as an investigating coroner, as a family physician, emerge physician, and now as a public health doctor. So thank you for raising that question. I do think it needs a rejuvenation of our efforts across Ontario. We need to double down on all we're doing from an addictions mental health vantage point to opioid agonist therapies to naloxone, to consumption and treatment sites, to enhance rapid access addiction medicine clinics, and harnessing primary care emergency medicine to be able to provide for the needs of these patients. I am very aware of its devastation to families at a very deep and personal level, and I would just want to assure you, I will be fully committed to responding to this threat on an ongoing basis once we can get COVID under control, and we've started working on that strategically within my office already.
Follow up, and this is the last question.
Thanks, Doctor. I was wondering if you could just get maybe a little more specific. I know there's a lot of different moving parts there, but for instance, Ontario's cap on supervised consumption sites, is that something that you think should be lifted? And also, I wanted to get your thoughts on decriminalization of drugs for personal use.
Yeah, so we are identifying, just from a policy vantage point, certainly the work I did in Kingston, Frontenac, Lennox, and Addington, we did a lot of work on policy, and decriminalization at a federal level, I think, is a policy direction that I would like to review and potentially endorse or support. I will be working with all of my provincial counterparts, including Dr. Bonnie Henry, who already has a position statement on this, as well. I have worked with Dr. Dirk Heyer as the chief coroner, who was instrumental in achieving further resources to support emergency medicine response to the opioid epidemic, including further knowledge translation activities regarding opiate agonist therapies, being able to directly provide them through emergency medicine at the interface with patients. So I do agree there's a lot to be done, both on the policy side as well as the direct clinical care side, and I have started working. I want to assure families who have had loss and death in their of their children or family members that we are working on this behind the scenes, and I've formed a small task force with Dr. Heyer, and we're addressing policy concerns and health system changes that we can adopt.
Thanks, everyone.